Hi everyone, my name is Dave Hammond, and I'm sorry I can't be with you in person tonight, but I'm delighted to receive the Trailblazer Award in Science for Policy. An award that recognizes impact on health policy is the highest compliment for my work. For the past 25 years, I've been doing research on tobacco control policy. So, how to unwind almost a century of influence from an industry that's been not only highly effective in promoting smoking, but also in undermining both science and policy. Now, I sometimes say that tobacco control is the poster child both for effective health policy and one of our most enduring policy failures. Perhaps no other public policy has saved as many lives, and yet we still have 4 million Canadians who smoke. It remains one of the leading causes of death. And science and evidence has been absolutely critical in demonstrating the need for these policies and also for defending effective policies after they've been implemented. So I've been asked to speak about a few highlights of my career tonight, and 3 experiences stand out. The first highlight was the opportunity to contribute to the world's first public health treaty, the Framework Convention on Tobacco Control. It set international standards for tobacco control policies that reach billions of people in more than 180 countries that ratified the treaty. Now, I had the opportunity to draft some of the guidelines in areas like health warnings and product standards, and the occasion that sticks out is a 3-minute presentation in Bangkok, Thailand. My son Jack was just born. I had to fly around the world. I was feeling a bit sorry for myself. The air conditioning in the hotel didn't work, so I spent 2 days in my underwear trying to figure out how to convey highly technical concepts of tobacco product science in 180 seconds to representatives from around the world. And as soon as it was done, I remember thinking, well, that was nice. My career just peaked at age 33, and it's all downhill from here. Now, the second experience was maybe more of a career lowlight than a highlight, and that was being deposed by Philip Morris for 14 hours over a 2-day period. And I've served as an expert witness on behalf of governments around the world. These are cases where companies try and strike down public health laws. The Philip Morris deposition was a big case. There was almost $1 billion sought in damages. And one of my colleagues who testifies against the industry had some simple advice. He said, get some sleep, eat a big breakfast, and never back down. Now, it was good advice as it turns out. The deposition started with a nice chat about the weather, and it ended with the lawyer shouting at me for more than an hour why wouldn't I answer his questions, and I felt like I was in a John Grisham movie. And after the second exhausting day, I took out my son Jack for pizza, who was 6 or 7 at the time. And that day in school, he'd learned about the story of Terry Fox, and he told me about how he ran around the schoolyard to raise money. And I actually started to cry at the pizza place. And it's because I was so exhausted, I was mentally spent. But it was also the day that I knew that this would be the direction that my career would take. Now, the last highlight I'll mention is a handwritten letter I received more than a decade ago. So it's fine to feel very smug about working with governments and testifying in court cases, but really it doesn't mean much unless it changes something. And I had received a letter from a woman in New York named Judy Murray, and she'd read an article in the New York Times about a publication of mine, some research. And she mailed me a picture of her tracheotomy, showing the hole in her throat from a lifetime of smoking in her surgery. And she had a terminal diagnosis, and she said she was one of the few survivors in her support group. And she wrote to thank me for the work that I was doing. And she told me that she had pictures from the health warnings on Canadian cigarette packs on her fridge. Those were the warnings that I was helping to study in my research. And she put the pictures on her fridge for her kids, but she also challenged me to do more. Now, I'm pretty sure that Judy isn't alive anymore, but I keep her picture in my office to remind her why we do the work we do. Now, looking back, tobacco control research was a baptism of fire for my own training. But there's always been a strong consensus about the need and the spirit in the public health community. I now work in other areas of substance use policy that are less equivocal. I work in contentious areas like e-cigarettes and vaping and trying to balance what these products may be able to do for smokers while protecting young people, right at the point where we're about to close the door on tobacco use among Canadian youth. I also look at things like legalization of recreational cannabis. Do we have more people using cannabis because of legalization? Has it reduced the illicit market? How many stores should we have? How have the products changed? These are questions about a broader conversation we're having in Canada about the role of substances. How do we minimize the harm from drugs, both among people that use them and among young people who we're trying to protect? What's the right level of regulation? Science and unbiased evidence will always be important to inform decisions. Just to wrap up, a couple quick thank yous. I was blessed with wonderful mentors, people like Jeff Fong, Roy Cameron at the University of Waterloo, who've always been generous with their ideas and support. I've also been lucky to work with many great non-governmental organizations, NGOs. And I want to take this opportunity to thank one in particular. That's Neil Collishaw, who is retiring this week from 5 decades of work in tobacco control. Neil used to lead tobacco control program at Health Canada. At the time when many cabinet ministers smoked in their office, we had separate smoking sections in airplanes. Neil also led tobacco control at the World Health Organization and has been with Physicians for a Smoke-Free Canada for decades. Now, I had the good fortune of sitting next to Neil at one of the first meetings I attended as a fresh new graduate student. And not long after, Neil said, "Here, you might want to read some of these internal tobacco company documents on their secret science, how they designed and tested cigarettes." Those documents taught me more than any course or textbook. We ended up writing a paper together in the Lancet Medical Journal, and it really helped launch my career. And while Neil's contributions are exceptional, they also typify the type of commitment and important role that many NGOs play. So finally, I want to thank the wonderful people I work with, the staff and students. I keep expecting them to leave for another job where the boss doesn't come in with toothpaste on his face or send kitten videos on YouTube on work time. I'm very lucky to work with such great people. And of course, the best part of my workday is when it ends and I can come home to my kids who've become little health policy advocates of themselves. Last month, my 10-year-old daughter did a presentation on the risks of e-cigarettes, and it included more nuance and balance than some of the national organizations I've been able to work with. And finally, thanks to my partner, Jen, for being so wonderful, for pretending to be interested in my work stories over many, many years. And thank you again to all of you. I'm sorry again that I can't be with you, but please enjoy the rest of the evening. Thanks.